Welcome to Dimapur today. आज हामी kan bisi lamba gap pichite ekta super specialist doctor lo tai kina ase. Ami kan into education purpose te ase. Okay, ami kan lo ta ase Dr. Mhasisielie Zumu, tai super specialist gastro ase. Okay. Ayi ami kan telo di bisi kotha janibo. Yes, thank you so much doctor for your time.
Thank you so much for having me on your show.
Okay. Okay, sir. Ami kan kotha tele first can we start with the alcohol. Ami kan ite Dimapur या Nagaland ते बेसिबक gastric problem नहले liver problem ते alcohol प्रदेश अपनी इतुला ते लोग को पड़ो.
Okay, so alcohol as such, mohala saite saisukli do alcohol do mohan country liquor bhi ase aru locally brewed alcohol kan bhi ase. So like whatever we are getting in Nagaland, we are mostly adulterated alcohol pass. तो ये दोनों alcohol खाइशिकली तो in the long run liver disease kan हो जाए और इतना ओपोटे gastric problem भी होलाई जाए.
Yes, yes.
और alcohol do it is one of the factor for cancer also.
Cancer. Okay, इत्ते अमी kan इत्ते alcohol ला कथा पर start करूँ. So इत्ते alcohol मुदु खाई कि ना मनु कितुवा पेट फुली जाए ना और ताई बेसिबक तो मरी जा नहीं आती पेट फुली जा लास्ट टेस्ट अपनी ऐसे super specialist की को
तो so alcohol initially मोहन consume करे शुरू हुई तांते liver मोहन slowly damage करे will be liver do it is such an organ that इदु बेसी बार compensate करेगे तो compensate करेगे वो last day ना पड़े बेसिकली इदु तमदुर मोहला manifestation jaundice kan दिखाई सुकुल लाल yellow color हो जाए no will be पेट फुली जाबो vomit करे तमते भी blood ओलाई जाबो इन्हें हो जाए और consciousness भी ना थके हो जाए ना इन्हें हो जाए तो इतु लो आगे दे इतु नोहा आगे दे आही ना चेकअप करो लगे केयर निकलो most of the time मोहन liver problem थकिली भी ना जानी ना थकिबो खाली स्कैन करले नहले भी टेस्ट करले जान जाबो कि इतु liver problem हसे नहले तो at the time मोहन ये सुकु तो येलो कलर हुई नहले पेट फुली सुकले तो बिशी देरी हुआ ला तम तीव्र इतु हन टेक रहे तो like we should have the habit that इतु खाई थे क्या सुकले तो चेकअप रेगुलर चेकअप करले बिशी बाल हो
मैंने खाई था का मन तो चेक को उठा के लिए बाल
होय
okay अच्छा liver failure ला cause तो क्या है main reason
so liver failure ला causes to बिशी ऐसे will be some of the most common causes of liver disease is like one alcohol khakane se to second to herbal medicines alternative medicine we call it alternative medicines like any other medicines which is not allopathic medicines na it won't karne bhi aise to and then fooding habits like with the modernization urbanization mohala fooding habits mostly western influence ho ase to obesity related fatty liver disease these are some of the most common causes of liver disease.
अच्छा मुझे तो क्वेश्चन देता है इसलिए तो herbal medicine ना इत्ते बेसी मनु इत्ते herbal medicine तो rely करे and बेसी वक्त लिए तो सस्ता भी है affordable अपनी की कोई तो is it okay to have and continue this herbal medicine liver tonics
so what will I like to stress is that in allopathy medicine which we prescribe तो मोहन बेसी बोला तो इतोहन टेस्ट करो साल टेस्ट करो टाइम लगे ना इतोहन अन्योले तो इतोहन साइड इफेक्ट खन क्या से इतोहन पूरे बिछवा मनु के सेफ हुई से इतोहन बिछवा यूज करे बोले most of the herbal medicines which I am not trained in like I see that itohan do they haven't done enough research for the safety of the people and all though people say that there is no side effect to all these herbal medicine there's nothing as such that we don't have a side effect everything has a side effect so yeah that's what I would like to stress.
Yes, itu herbal medicine bisibak manu bikri kura then side effect ekku nai ko itu liver excuse me liver karne bhala ji but you as a super specialist apni to recommend na kuri
recommend na kuri to
ite khai thaka to so bon kuru lagibo Okay, itu yes sir. Apni itu juntu agiti go tu liver failure ne. Tu itu kitiwa itu mudu khai thagi na manu khai ase khai. Tai chronic alcoholic ase. Pale khai na vomit kurna
Oi.
hospital jaise. Aur bisibak manu ko liver phati jaise.
Oi.
Itu ki ase.
So mohan liver aidu mudu khai thakile to mohan liver do damage huina last idu shrink ho jai na to shrink ho jai chikule to idu blood adu liver de jai thake to backflow ai jai to backflow ai wo pressure build kuro itu tamte ituan phati na itu intestine pura phati jai mohan la nari de pura phati jai to phati chikule to tatu pura mohan blood vomit kuri jai নহলে বি মহালা motion de sai chukle mohan kala paikhana bhi ho jai to itni ho chukle to thon to beshi dangerous ase and then nowadays we have therapies na mohan endoscopic korna ithon bend korbo ithon bleeding stop kordu boli bhi iti to facility ase
Itu apni itu kala paikana ne black stool. Itu bi ekta symptom ase niki.
itu bhi hoy ekta symptom ase
And vomiting.
vomiting blood vomiting fresh bhi ho pare clotted bhi ho pare aru kuma tamde black mohala motion black bhi jai jai to not all black motions are related to mohan intestine bleed hose inya garmi min hoy to black motion to kuma tamde mohan beetroot khaise kilbi kala pakhina ho jao pare mohan monso bishi khaise red meat khaise will be black stool bhi ho jao pare will be if you are drinking alcohol and then if you have pain abdomen aro idu tamde black stool or like these are the warning symptoms you should come to a gastroenterologist and then get checkup
Mane itu time itu aija bola. Treatment recovery to chances.
yes
Any stage.
yes there are some we have treatment for all these patient though they are decompensated one ito han kuishikuli to liver decompensation state hushe nya koi theke but still we can help them out
Okay, chances to us.
yes
Any percentage kiman?
so in that stage when tan decompensate hushe nya kuishikuli to like it's like percentage to I cannot tell the exact percentage but there are chances that we can revive them back we have good therapies like to itu to liver dialysis can be or liver transplant and then we have albumin therapies which quite helps in this one itu pani pete pani jama ho jai to hala treatment can be balance will be recovery it depends on the liver mohan whatever we are doing we are just helping the liver so liver mohan automatically mohan liver health to increase kori to tai he recover koro
Acha ulcer to kiman related ase itu lo.
so ulcer to there are different reasons for ulcer gastric ulcer duodenal ulcer so ulcer to mohan beshi bola to but ঠিক টাইম de na khai নহile bi fast food khan khai bahar de food ki khan khai dike to over that we can get infections with bacteria specifically called H pylori to infection usually itu karne bi কোন তুমি আলসার ওলাই যাব এটো কারণে পেট বিখাই যাব আর কোমা তুমি মহান খালি পেট থাকিস বলি তো মহান গ্যাস্ট্রিক তো সেক্রেট তো করেছে না এটো কারণে বি আলসার হয়ে যায় আর there are other reasons also but these are the common reasons for ulcer development na
Pan masala gutka.
These are like ito hando like in the these are the risk factors for cancer development na
Acha.
तो ito han bi ulcer hi develop probo holibe ito han ulcer to cancer la ulcer probo there are two ulcers one to cancer la ulcer aru one dusra wala to benign ulcers koina to ito han to cancer la noy ito han to treatment kore to bal ho jay
Itu ekta bisi latest information is. There are two types of ulcer. Duita kism la ulcer thake ekta to cancerous.
yes cancerous ulcer and benign ulcers
So right wrong tam you need to choose school like. Okay. Yes, doctor itu ki ko bleeding na gastrointestinal bleeding itu narila. Itu mudu kha karne kiman hoyo itu.
So most of the reason mudu kha karne bleeding hoise nya hoise to one thing maybe because of ulcer gastric ulcer one खाली पेटे मुदु खाए
Okay.
in aru bat khan thik tang time na khai ito ang kane bhi ho jaw pare second thing because of our fooding habits na to H pylori infection thaki kane bhi ho pare third thing it can be because of the one liver to shrunken hoishikulu to backflow pressure ahina idu phati jai krishna idu nari de phati ala to ang kane bhi ho pare and finally it can be because of cancer related also so all these things are related so kumadam the bleeding it can be bleeding from the upper gastrointestinal tract na sometimes it can be also from the lower gastrointestinal tract matlab bleeding to mohanla chutu nari karne bhi ho pare dangor nari bhi ho pare mohanla stomach karne bhi ho pare
Okay.
yeah
মানে এইটো রিজন ফ্যাক্টর আলাগ আলাগ আছে
yes alag alag factors
আচ্ছা ডক্টর এইটো চিল্লি না এটা আমি কান কিং চিল্লি
yes
নাগালেণ্ড তো এটা নাগামন্ত চিল্লি তো নাথাকিলে বাত নাকে চিল্লি বি কিবা রিজন আছে এইটো আলসাৰ কাৰণে
yes itu wait chili bhi bishi khaise inya usually to obviously these are stimulating the gastric secretion na to gastric secretion bishi use inya usually the acidity bishi howa karone bhi ulcer develop hoi jao yeah
ওকে মই এইটো আমি কান বেছি কমন মানুহৰ কাৰণে হুদি দি আছে আৰু এইটো দিব স্মক পক খাইলে বেছি ডেঞ্জাৰাছ হ'ব দেখি
so these
Smoke meat.
yeah smoked meats and all no they contain nitrous compound na so itu khan to these are carcinogenic
Okay.
na carcinogenic matlab cancer cause kore na these factors for cancers to itu smoked meat can be itu khan karne bhi ho jai
Okay. So food habits to be important.
yes food habits is very important
What will you recommend? আপনি কেনেকা food habit to বানাইলে ভাল করব মানে
so like one edu mohan balanced diet koi na to balanced diet to mohan we should have fruits we should have green leafy vegetables also non veg khan bhi khabo lage but then up to a limit na to balanced diet to thakibo lage fruits kan itu green leafy vegetables kan aru edu meat khan bhi red meat khan bhi komti koro lage red meat are also responsible for all our problems
Okay,
gastrointestinal problems yes
Okay, besibak manuhan there are people like old age na
Yes.
mid 50s 60s kan takan koi moi to 10 years 15 years ka pet because gastric ase to some ki garne ase nisna lagi
so man gastritis gastric problem it don't be way over the long years na mon thik tak nasaina tagli do bishi bola do it will lead to cancer okay so the thing is early detection korna whichever small tumors are there we can remove it okay otherwise in the long run into han lui jai na cancer will develop ho jai specifically in the elderly age group na so it is mandatory for to get screening done for elderly age na if you have pain for a long
Long time.
maybe 2-3 years like that
okay that's a common like heartburn no ile digestional issue
yes
loose motion no like ekdam tan hoy to ki koi ke bole
constipation
constipation
Yes,
it one to constipation it one kinega
so heartburn these are all different thing na it one be alag alag problem ase to heartburn bishi bola to mohan like bat thik time de na khai nohile bhi bishi acidic juice khan bhi khai nohile bhi coffee khan bishi khai to aro anxiety na sleep bhi thik na thake inya skole bishi time to reflux ho jai
sleep be important as
oh sleep be important ase so these all things will cause reflux na to reflux and then there are some other reasons surgical reasons bhi thake only most of the time it's because of our lifestyle na aro next thing though you say constipation constipation be it's related to food your fooding habits and all but there are other reasons especially in elderly age group more than 60 years of age constipation chronic constipation aro constipation thakitam the blood can be olai usually to you should encourage them to come and get colonoscopy get screening done because these are the symptoms for cancer this cancer bleeding and all can be there so that's what is important it's like the guidelines can be recommend great more than 50 years more than 60 years usually you should get a colonoscopy done
okay
yes and regarding that loose motions and all loose motion one bishi utalo loose motion 2 din 3 din thakisule these are just infection related or sometimes food poison related. But there are some people who have loose motion for 2 months, 3 months, 6 months. These are the patients, which need to be evaluated. Na, ituhan ahina evaluate ko lagi. Kaya na kuli to mohan la lifestyle to pila zamana la lifestyle ba itu to urbanization, Western life influence, food in kan. Ituhan changes ayesan na. So they are like IBD. That is inflammatory bowel disease, then IBS, all these things are happening because of westernization, and this also can cause chronic diarrhea. And also there are other factors like because of chronic alcohol consumption, तो pancreas मोहला pancreas की भी damage कर दे, तो pancreas ला juice तो food digestion करने थे तो इतो destroy कर चुके तो food भी digest करना पड़ेगा. আৰু you আপনি লা পেট তো ব্লটিন না ও পেট ফুলি যাব অলপ সামান খাইলে পেট ফুলিব আৰু লুজ মোশন হ'ব আৰু কমজোৰি হৈ যাব ইয়া হৈ যায় এইটো হান্ড দিস আর দ্য alcohol related pancreatitis में থাকে अलग causes kan में ऐसे but alcohol related since मोहला जगह दे alcohol related बेसी problems ना
yes
এইটো কাৰণে
अच्छा अघि त सुरुको निस्न itu पाइखानाको स्टुल पाइखाना दुले एकदम तान जासे और ब्लिडिङ जासे गुल पारतक बेसी जल्दी स्क्रिनिङ टेस्ट खान कुरुले त भाल आसे itu encourage करि आसे yes itu okay yes sir I have one question with you itu आसे सबै itu मनु कुनबा त मुदु छाड्दैन ले एकता क्रेभिङ आइ जाइन खाओली किबा मेसेज छ अपने.
So, itu craving can't, we have a separate specialist to deal with them. Na? So, craving can't do like, it's once you develop addiction to something, it's very difficult to, so you need to seek a professional help, no? So, we have it, So, tahanki kuro like professional doctor can help like low like আৰু দাৱাই না ক্ৰেভিং কমতি কৰিবলৈ কাৰণে দাৱাই বি দিব আৰু এনভাইৰনমেন্ট মহলা এনভাইৰনমেন্ট বি চেঞ্জ কৰি না ডক্টৰ খান থাকে না ডি এডিকশন সেন্টাৰ খান ইটো আন থাকে না চেঞ্জ কৰি দিয়ে না দ্যাট ৱে ইট উইল হেল্প এণ্ড মোষ্ট ভেৰি ইম্পৰ্টেণ্ট থিং ইজ ফেমিলি ছাপোৰ্ট মহন বেছি বোলো ফেমিলি খান ট্ৰিটমেণ্ট কৰি থাকে না গিভ আপ কৰি দিয়ে না only family support to सबसे important is in all this through all this phase na
अच्छा कितबा itu blackout हो जाए ना itu gastric करने में नहीं.
So blackout usually heart related, mostly heart related na
foggy food.
Yeah, so mohana do blood to do mathati pump korle means blood circulation to the brain man নাই হৈ যায় শুকলি তো ইটো কাৰণে বিপি কমতি হৈছে নহলে হাৰ্ট ৰেট কমতি হৈছে ইটো তামতে ব্ল্যাক আউট হ'ব পাৰে.
Thank you so much.
So that is a different specialty.
Thank you so much, sir.
Yeah, thank you so much. Yeah.
Yes, ami kan ek bar last month for like the lab inauguration kuro time de jani se takhan do more than 5,000 bimar test kuri which means dunia de bimar do uncountable ase na. Okay, to itu ekta bimar la kotha goile beshi ulai jabo but apni kan if you appointment lagi sir lo thi koile ami kan number likhi dibo na to tete ai jabe aru tai ki apni kan Nikos ti log pai jabo Nikos Hospital Dimapur de you're available.
Yes, yeah.
He's a super specialist ase tai the gastro te aru ami kan Nagaland te ekdam countable ase bisi komti ase super specialist and he's one among them. Thank you so much, sir, for your time. Ami kan aru tai lo taibo second time ete aru in depth te একটা topic te kotha kobo next apni an bi comment de dibi kundu kotha de koile bhal. Thank you so much, sir.
Thank you.